And thanks for staying with us for News 3 at 5. In an attempt to stay ahead of the spread of the Zika virus, the CDC has issued new recommendations for women considering becoming pregnant.
To date, there have been more than 5,000 confirmed cases of Zika in the United States, and of those, 224 were believed to be transmitted in the U.S. by mosquitoes. Our Dave Delosier spoke today with two experts, and he's here now with more on what this all means. Dave.
Yeah, actually what this means is, just as in last year, the Zika virus is something of a moving target. In one short year, we learned Zika can be transmitted sexually, and the two different mosquitoes in the U.S. can carry and transmit the disease. The move by the CDC is one of several things they are doing to try to stay ahead of the Zika.
I think we had a lot of uncertainty with Zika virus last year.
Based on what was learned last year, the CDC is issuing new recommendations to women considering becoming pregnant. The CDC recommends women living in or visiting areas where Zika is known to have been transmitted by mosquitoes get tested before becoming pregnant. They then recommend testing once every trimester. The Zika virus has been found to cause severe birth defects in children. For women in Wisconsin who haven't visited an area at risk for Zika, there is less concern.
In Wisconsin, I think women can rest relatively well assured that Zika virus transmission is pretty unlikely.
That's because the Aedes aegypti mosquito, the type most associated with Zika, is only found in southern states. The Aedes albopictus, or Asian tiger mosquito, can carry Zika, but has only been found in states neighboring Wisconsin.
There hasn't been Aedes albopictus identified in the state of Wisconsin in the last 21 years. That said, I know that surveillance is going to increase to look for that mosquito.
So this year we're going to look again, and we're going to look in a much more kind of targeted way.
Dr. Susan Paskowitz is the chair of the entomology department at UW-Madison. She is also heading up a newly created regional center funded by the CDC to deal with vector-borne diseases like Zika. The center will coordinate training and surveillance and try to stay ahead of the Zika virus.
So we can look at last year and say we didn't find any Aedes albopictus, no Asian tiger mosquito in Wisconsin, but we don't know what that's going to look like this year, and we also don't know what that's going to look like as we see this continuing warming in the climate. We're definitely watching the mosquito kind of crawl up in the United States.
Now, the Center for Excellence that Dr. Paskowitz will head up is funded for $10 million by the CDC. It will target mosquito surveillance in the upper Midwest and look for mosquitoes capable of carrying the Zika virus. But there is a wild card in all of this, Eric and Susan, and that is that in the past, the Zika virus has jumped from one breed of mosquito to another. Obviously, the hope is that it will not do that again. But it does explain why the CDC is so active in trying to stay ahead of this thing.
And Madison becoming a center of the fight here, too, right on the front lines.
Yep.
Dave, thank you very much.
Thank you, Dave.